First of all, I'd like to thank Michelle for inviting me. It's really a privilege to be able to speak in front of this distinguished audience and my co-panelists. As Michelle said, I wear many educational hats, but I'm the director of the VALUE program. So it stands for VA Longitudinal Undergraduate Medical MS-Squared Education. So what that means is, you all know the traditional clerkships. So the students spend 2 months, 1 month, 2 months in a certain clerkship, dive deep into that clerkship, finish, then move on, and perhaps retain some of the information, but most often they tell me they don't. So what we have done at the VA is, in collaboration, of course, with the University of Minnesota, we have recruited 10 medical students in their 3rd year of medical school. So they spent 10 months with us, so almost the whole year with us, and they did 5 or 6 clerkships simultaneously. So they did medicine clerkship, surgery, surgical subspecialties, psychiatry, neurology, primary care, and we did a special elective called VALUE elective. So in this VALUE elective, they deep dived into QI, so they completed a QI project longitudinally over 10 months, and we focused on interprofessional education. I know that we have just had 1 year. We are about to complete 1 year. It's probably way too early to come to a conclusion. But I am convinced that this is the better way to educate medical students. And I'm going to try to convince you within the next 3 minutes that that really every medical education, medical school training should include a longitudinal experience. So when I reflect on the experiences of the medical students, I sort of try to think of the benefits in 4 or 5 broad strokes. So I'll try to name them and maybe give one patient-related example so that it's clearer what I'm talking about. So first, patient-related benefits. So we're all clinicians. Patients come first. And to me, every educational program should look into patient benefits. And after 1 year, I'm very convinced that VALUE students really added value to patient care. And let me give you a few examples. To start from the most basics, that they most certainly improved coordination of care with those patients. So each student has about 20 or 30 assigned panel patients. And those are their patients. They see them in primary care clinics, and they follow their care across different care venues. So they go to MD appointments as well as the non-MD appointments. So they really follow these patients across all care venues. So guess what happened? Within a few months into the rotation, they actually knew how to get things done better than me, who has been practicing there for 15 years. So I think that's amazing, the level of coordination they were able to provide. I see a patient in clinic, I could never get the semen analysis done, and I get frustrated. And Catherine says, well, I know exactly who orders this test. I'm going to go talk with him. She gets it done in a day, and not only that, but calls the patient with the results. I'm like, oh, that was good. So, they really do a wonderful job. But beyond care coordination and communication, they really formed a very close and trusting relationship with the patients. So I think that was the most moving part for me for this. They came to a point where patients saw these students as their doctors. So I think that's pretty amazing for a 3rd-year medical student. I hope you agree with me. So they were their student doctors. For example, in a clinic, when I had a disagreement with a patient who wanted all the tests in the world done, and I was saying no, and the conversation was escalating, the patient turned to the VALUE student and said, is she right? Should I do what she says? That probably doesn't speak so highly of my clinical competence, but this is a very true story. in certain instances, they really made a big difference in patient care. For example, for a patient who one of the students followed over a course of a month or 40 days and saw the patient multiple times a day, at the end, the patient was about to have a very difficult end-of-life discussion and really refused to have this discussion if their student doctor wasn't there. So I think that's very impressive. So Stu was the student was very impressed with that as well. In another incident, for example, for when a 90-year-old patient was admitted to the ICU, the student was the only provider, only person in the ICU who were aware of the patient's wishes, so really prevented an unwanted intubation in that patient. So I think these are all anecdotal stories, I realize, but I feel like they are very important and demonstrate the patient, how value students contributed to patient care. So that's the patient-related benefits. Moving on to student benefits. So students really bonded with their patients and they got to know their patients really, really well. For example, in one case, this was a patient who was a Vietnam veteran, and he was a prisoner of war, he had PTSD, and all this. So brought the student like a folder to read about him, not the disease, but what happened to him. And so Catherine, the medical student, really got to know him as a person. And he had alcohol issues and drug-seeking behavior and things like that. But when he was admitted, that patient was a person for the medical student rather than an alcoholic, drug-seeking behavior. So I think this really shows that we were able to confirm the literature, which says that normally in medical students, empathy declines over years. We did not see that. We actually, our students are very empathetic and bond very well with their patients, and we partly think because they see them and know them as a person over a really, 10-month period of time. They got excellent education, but they got education in certain areas that you wouldn't expect a medical student to get comfortable. Oh, okay, sorry. I'm going to wrap up. Do I have one more minute? Okay. The preceptors. So I know that you want to hear what the preceptors think. They loved it. They had all sorts of concerns initially about, well, students are more time-consuming and this and that, but they owned those students. They absolutely owned them. And they said, this is my student. If I don't teach this student, no one will. So they would, if they had 10 minutes, they would go to their room and teach something. They became coaches, career mentors for them. And just to quote one of the preceptors, Dr. Peter Weissman, who has been an educator forever, many of you might recognize the name, and he said, this has been the most satisfying experience in my entire life as an educator. So I'll stop with that.